Hey, welcome back in this morning. We are starting a new segment here that we're going to do on a regular basis once a month, where we're going to talk with Dr. Mark Wilson. He is the head of the Jefferson County Health Department, talking about something that affects all of us, obviously our neighborhoods, our health, and some new rankings just came out this morning, and that's what we're going to focus on today. So, Dr. Wilson, good to see you.
Good to see you. Thank you for having me.
Thanks for coming in. So we're talking about local health issues, the new county health rankings across the state. Before we look at a graphic that you guys provided for us, what does that mean exactly? What are the rankings about?
Yes, this is something the Robert Wood Johnson Foundation has been doing every year for the last 4 years or so, and it gives us some general data about the status of the overall health of our county compared to other counties in the state and compared with the national average.
Okay, well, let's look at the first graphic we can put up. Susie, if you can put those up for us. All right, what are we looking at here? Obviously, the different counties are in different colors there. Kind of break that down for us.
Yes, if you will, people that have internet access can go to the internet actually and look up county rankings, health rankings, Robert Wood Johnson Foundation.
Because Shelby County is #1, right?
That's correct, and Jefferson County, I believe, is number 27 this year.
Okay.
But you can, if you go to this website, you'll see that map, and you can just click on a county, and then you can get details about the ranking and read about what went into that ranking.
Okay, so in the white, those are the healthier. Is that how the rankings? I think Shelby County is.
Yes, I believe so, yeah.
All right, so when you say rankings and you look at this, the Southwest, a lot of dark green, those are the.
Yeah, you have areas.
Down the list.
Yeah, I mean, if you look at the details of this, what this helps point out is when the things that go into these rankings are not just what you typically think of in terms of health, like health care or whether people get exercise. Those are important. But there are a lot of other factors that go into this, such as poverty, educational level, the types of neighborhoods people live in. And so you will see a correlation sometimes between other things such as poverty, educational access that have a really big impact on health. And that's what's really important about this ranking. The numbers and the details of the numbers may not be quite so important because, frankly, all across Alabama, they're not as good as they should be.
Okay, as we tell folks what's important about this, you talk about the poor communities, a nicer community. You say a poor community really, not just because you don't have access to, you don't have a lot of money, but it really affects your health where you live.
Right, yes. Poverty, lack of education, where you live, these are things that actually have a bigger impact on someone's health than how high tech or what the quality of the health care is. We have some of the best health care in the world here in Jefferson County, and yet we have some major public health problems that are very stubborn.
Jefferson County, big, huge county, houses, the city of Birmingham, yet we're down in the rankings, so where we go to forward as we wrap up here today?
Yes, what we really want to do is try to influence these other factors, where people live, the quality of life, things like a safe place to exercise, a grocery store where you can get good fresh fruits and vegetables, better education. Public health as well is extremely important, making sure that the sanitation is good, healthy foods, vaccinations, all those things are still there.
All those things affect our health in one way or another. All right, Dr.
Yes.
Wilson, we look forward to continuing our conversation, and we'll see you again next month.
Good. Thank you very much.
All right, thanks for being here.